The next topic we're going to be talking about to finish off our series of acid-base disorders is respiratory alkalosis. How do we define it? What's respiratory alkalosis? This is an increase in blood what? pH. It's alkaline, guys. We've talked about this. If you don't understand, it's the first time you're watching this video, always go back. We've made videos on introduction, so you're not missing much. It's very important. So there's an increase in blood pH. Don't you guys just love this formula? You become a superstar the day you memorize this formula. But it's not much I can do if you don't. Something is wrong. Your pH is what? It's really high in the blood. And it's due to what? Because it's respiratory, so we're going to stay below the formula again. That means what? If your pH is going up on the top, the only way this could be happening if you're in respiratory alkalosis. Alkaline means a lot of pH, right? pH greater than what? 7.45, right? That means PaCO2 is low. You know what? I think this is actually one of the easiest, because what causes people to what? To go into respiratory alkalosis. The major cause is hyperventilation. So what do I mean by that? That means your PaCO2 should be less than 40. What do we mean by that? If your PaCO2 has to be less than 40, what do I have to do? I have to breathe really fast. Right? When I do that, what happens to my pH? It starts to go up. That's a respiratory alkalosis. That's it. That's pretty easy, guys. It doesn't get easier than that. But there's always a little small little thing you got to memorize. Since you guys are pros at this now, you should be telling me the answer to this. If at the bottom we are undergoing respiratory alkalosis and our PaCO2 is dropping because we're blowing it so fast out of the lungs, right? It's coming out so fast. The only way we're going to fix it is what? Metabolically, right? Because now in this case, my pH is low. I'm sorry, apologize for that. It's high because my blood pH is very high, because down here my PaCO2 is so low because I'm hyperventilating. The only way I can fix this is to bring this pH down is by doing what? Decrease my bicarb, decrease my bicarb, decrease my bicarb. How do I do that? Remember, if the lung is where the primary problem is, the only person that's available in the entire world to help you is the kidney. So the kidney says, I got your back. I got your back. I'm going to start doing what? Excreting out all the bicarb out of my system. What are you going to do? You're going to be peeing your brains out, right? You pee out the bicarb so that if I pee it out through the kidneys, that's the only way I can get it out, right? We lose bicarb excretion. That's how we're going to fix it. So metabolically, if I keep peeing this out and my bicarb is decreasing and decreasing and decreasing and decreasing, it's less than 24, what will happen to my pH? My pH will start to drop down slowly, because that's how the body compensates. It's all compensations. You scratch my back, I scratch your back. That's it. So now, let's talk about how the kidneys acutely and chronically compensate. Right? Remember, the kidney is slow. What do you expect? The guy's sitting back, retroperitoneal, just having a good time with a bottle of wine? No, it's just, it's working very hard. So in an acute situation, for each 10 millimeter decrease in your PaCO2, right? Which means for every, this is acute, by the way. So I should have actually erased this, because the next thing we're talking about right now is compensation, right? Because acutely and chronically. By the kidneys, by the way. Little kidneys. Smiley face. Right? Acute, for every 10 millimeters of mercury decrease in PaCO2, which is the primary problem, right? We're breathing out too fast, so we're blowing out all the CO2. What do you think is going to happen to our pH? Our bicarb actually decreases by 2 millimoles per liter. Actually, you can use 2 milliequivalents per liter of bicarb is lost. Shall we do a problem? No, not yet. Because then this will increase our pH of our blood by 0.08 milliequivalent per liter. I like to do problems so we can kind of put this in perspective. There's a bunch of numbers. Basically, what we are saying is this. Let me erase this so we can see where we are. Let's erase this so we see where we are. This is pH, right? Let's start from the bottom. For every 10 millimeter decrease in PaCO2, so let's take a problem here and pick a bunch of numbers, right? In the corner here. Before the kidney compensate, the PaCO2 was 30. You're already hyperventilated at this point. You're already blowing it out. The pH is already dropped. And the only way, so let's say this is 30, right? The only way to fix it, and we know the pH is going to drop anyway. And the pH, let's say the pH, let's pick a good number, 7.2. Okay? Just for the sake of it. Bicarb, which has to be peed out. Remember, the kidney has to compensate. The bicarb was it's a 24 at this point, actually. So if we were to do the math for every 10, so if PaCO2 goes down by 10, and now you're down to 20, that's a lot, right? You drop in this area. That's where the problem is. That's the primary problem. The only way to fix is to come up here. Bicarb will drop by 2, which means 24 minus 2 will be what? 22. This drop in bicarb will help you bring your pH back up slowly by 0.08. Do you guys get it? That means our pH will be increasing by 0.08, right? That means we're going to have 7.28 increase in pH. Do you guys see that? We're getting closer to 7.35. That's basically what the math is. All right? So now we've known how the kidney compensates acutely. How about chronically? Not much is really changing much. The only difference, remember, chronic is always going to be higher. What you should expect in the chronic situation. So we've done with acute. I would expect this number to be what? Higher. Actually, 5 to 6. And this is actually 0.02. So if we do the math, if this is a chronic condition, right, somebody has a lot of COPD for so long, right, and they're always hyperventilating every time they go into what? I'm sorry. We didn't even talk, we haven't even talked about the causes yet, so we're going to talk about it in a minute. But for chronic compensation, right, and COPD patients can get respiratory alkalosis, but that would be like if they have sepsis or some kind of problem like that. So for every 10, again, which will be, they'll be down to 20. Now the bicarb, they're losing a lot of bicarb at this point because there's some serious thing going on. So the bicarb will be going down by what? 5 or 6. So if you subtract, let's say 6 from, that would be 18. Look at that. You're losing a lot of bicarb. Your bicarb drops. And what will happen to your PaCO2? We add that 0.02, and that will give us 7.22. So this is just formulas that are extra information I'm teaching you guys. This is probably what, people that do a lot of respiratory therapy calculate to make sure everything is going on. Computer probably crunches out the numbers, but it's always good for me to be complete, right? All right, great. Now that we're done with that, let's talk about what causes respiratory alkalosis. You've seen this a million times. Trust me, it's probably happened to you before. How about this? Have you ever seen somebody nervous before? People that have anxiety. They don't look nice and cool, right? They're not chilling by the hallway like, hey. No. They're freaking out. Oh my God, they failed an exam. Oh my God, somebody died. Oh my goodness, something bad is going to happen. They start to hyperventilate. They go into respiratory alkalosis. The next time you see somebody like panicking, freaking out, you know they're what? They're hyperventilating. How about this? This is very common. People that have tachypnea, pulmonary embolism, very common. Their heart is racing so fast, they're breathing really fast because there's a clot in their lungs. So that's actually another cause. How about this? Sepsis. How does sepsis cause you to go into respiratory alkalosis? That's a good point. Sepsis, right? Which is what? Infection in the blood. You already got a bacteria sitting in there. You go into systemic vasodilatation. You start off having metabolic acidosis, right? However, how do we compensate for metabolic acidosis? We hyperventilate. If we do it for long enough, hyperventilate. If we hyperventilate long enough, what we will develop? Respiratory alkalosis. Does that make sense? Right? The next thing is also mechanical ventilation. If you put on if a ventilator is breathing too fast for you and is blowing too much CO2 out, basically anything that can help you get CO2 out of your body faster, basically causes hyperventilation, right? Another thing that I think is a high yield information you guys should know about this is what? Aspirin toxicity. Salicylate. Salicylate. Let me make sure I'm salicylate, right? Salicylate. Right? Aspirin. Notoriously known for causing lactic acidosis. Remember the mud piles? Yeah, I know. Everything always comes back and bites you in the butt. What happens? They go into metabolic acidosis with an iron gap. Then they hyperventilate so much they develop a what? A respiratory alkalosis. Pregnant women, they have a lot of progesterone in their body. They hyperventilate, right? So you want to know that. So what are they going to come with signs and symptoms of these patients? Let's talk about that for a minute. Symptoms, right? Since these patients are hyperventilating, right? Which is when we said if they're hypoventilating initially for respiratory acidosis, if you breathe out too fast, you decrease what? CO2 means decreased cerebral perfusion, right? To your brain. That's not cool, right? That will cause vasoconstriction, right? If see all the blood vessels in your brain is constricting, guess what? You're gonna be lightheaded. You're gonna feel dizzy. All of a sudden, you get lightheaded. You get dizzy, right? These patients, they start to get tingling and numbness. They also get tetany, right? Tingling, paresthesias, basically. Paresthesia. Okay? And they can also develop arrhythmia. So this is bad, right? If you see people hyperventilating too much, you got to fix what the problem is. That's the only way we treat it. You find the underlying cause, right? If they have a pulmonary embolism, you make sure you pick it up on CAT scan. If you have to do a CT, angio, to be able to see, to make sure they don't have a clot in their lungs, that you're going to have to give heparin, right? And eventually give them warfarin, so you treat that. If they're very nervous and they're anxiety, you give them a benzodiazepine, right? You give them Ativan, you calm them down with Ativan, which is probably, you could give them lorazepam. They calm down, all right? If they go into sepsis, you're going to have to treat that. We're going to talk about sepsis soon in a different lecture, But you're gonna have to fix that because their heart is getting strained. You start to pump blood against this external vasodilatation in their body, and that's why their heart rate is so fast, because they can't keep up. So you want to fix that, right? If they're pregnant, there's not much we can do about that. All right, okay. If they take aspirin, you're gonna have to give them bicarbonate, right? You give them sodium bicarbonate because aspirin is salicylic acid. So if I have an acid in my body, let me see how I get rid of it. I'll use a base. Yeah, how about that? We put bicarb. And bicarb allows them to alkalinize their urine and get rid of the what? The aspirin. If it's too much aspirin in their body, you have to put them on dialysis. So you fix it that way. Basically, you fix the underlying cause. Also, you can tell them to breathe in into brown paper bag. That can also help so that they can inhale back some of the CO2. That's a good idea. Actually, that often happens to a lot of people. Okay? All right? In pregnancy, there's not much you're going to do. So now basically that's the end of our lecture. You guys are now master planners. You guys become gods of acid base. The mysterious, most difficult concept in medical school, pharmacy school, nursing school. Jeez, I never knew it could be this easy. Yes, it can. You just need somebody to tell you exactly what's going on. All right? I hope you enjoyed this lecture. And that is the end of respiratory alkalosis. Don't forget to subscribe to our channel. Also, you can support us by clicking on the ads below. We will surely appreciate that. And you can go to our website, www.ftpinc.org, or check out my YouTube channel, www.youtube.com/TOMIWA007. Have a nice day. Bye-bye. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX, or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, be able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome. And do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.